Okay, so let's quickly some few information about hemangioma and then do it together.
Okay.
All right, so the most important things in skin lesion, we have to ask about these things because this is like indication for cancer, skin cancer. So use weighted 7-point checklist for assessment of pigmented skin lesion and to determine referral. So major features of lesion, if it is change in size, irregular in shape, irregular in color, and the diameter 7 millimeters or more, inflammation, has discharge, and change in sensation or itching. So these symptoms we will ask in all skin lesions. We will ask these questions about the site size, shape, and any change in size, any change in shape, any change in color. So, and also any discharge and or oozing and the size of the lesion, is it increasing in size, and bleeding or any itching from the lesion, and exposure to sun. But this is because it's a child, so the cancer is very rare, but still we'll ask all these questions regarding the skin lesion. But the cancer in children very rare, but still we have to ask. Okay, so this is the one they brought in the exam in the cheek. So one like this, because it's affecting the vision, it needs treatment. But the one they brought in the exam is a tiny one in the cheek, so it's not interfering with function, so we don't need to treat at all. Just reassurance for the mother. So an infantile hemangioma is a type of benign vascular tumor that affects babies. It appears as red, blue, raised region, typically grow until about 5 months of life and then shrink in size over the next few years. So by 5 to 7 years, it will disappear completely. So we'll tell the mother about it. We reassure her like it will shrink in size gradually until it disappear at about 5 years old. So if like this, it needs treatments, we can give topical beta blockers or also there is some steroid also as well. We can give topical. Also there is surgery as options, but otherwise it's not. So it can bleed. That's why it's also if it is too big. So this is the options of surgery: beta blockers, corticosteroid, and laser surgery, but only in symptomatic that interfere with the functions. So this is the indications of treatments. So infantile hemangiomas differ greatly in terms of size, location, risk, and risk of complications, rate of proliferation, and a result after involtions, and treatment is therefore individualized. Information leaflet states that most hemangioma do not require treatment except in the following situations. If the hemangioma is particularly large or affect areas where resolution may be incomplete, such as around the nose, lips, or ears. So the station will ask where exactly the lesion is, so we know if it is in the nose or lips or ear, we can give treatment. If the hemangioma is ulcerating, we will give treatment. So we'll ask in the history any ulcer or not is very important, as we said. If hemangioma is interfering with important functions or development of senses, such as feeding, breathing, hearing, or vision, we can give treatment. Treatment which are generally off-label can include topical or oral or intravenous or intralesional corticosteroid, topical timolol, oral propranolol, laser treatment, or surgery. Emollient, non-adherent dressing, pain relief, and antibiotic may also be required. Yeah, so also just we can give this mother emollients if she insists for something. So we can just give him some emollient to, or if he has itching, we can give some medication for the itching. So we always remember symptomatic treatment
Do another state.
Yeah, but reassurance. All right. Okay, so let's do. Someone kindly put the time for us and tell us when it's finished.
Hello.
Yes. So the task is you are FY2 in GB clinic, a mother of 2 years old James has some concern regarding her son. Please address her concern and discuss initial plan of management with the mother. So all pediatric patients, they don't bring the child with them. So it will be same, even if it's face-to-face, it will be same like telephonic consultations because there is no child in the room. So we will ask her to bring the child for further assessment examination. However, we will name everything like, is it okay to bring your child to assess him, do general examination and assess his vitals, including blood pressure, temperature, and for example, examining the lesion itself. When you say this, they will give you the picture of the lesion. Yeah.
It's in the GP clinic?
Yes, GB, face-to-face. Can one put the timer, please?
What is the name of the child, please? I could not listen at that time.
James.
James? Okay.
Yeah. Is anyone going to put the timer for us or?
Yes, I'm putting on the timer.
Thank you so much, guys. Yeah, thanks. All right. Let's get started.
Okay. I'll start.
Yes, please. Yeah.
Okay. Hello.
Hello.
I'm Dr. Asma Al-Husna, one of the doctors here in this GP clinic. Are you the mother of James?
Yes, hello.
Hello. So can you please confirm James' age?
He's 3 years old. Yeah.
Years old. Okay. So how would you like me to address you?
My name Amanda.
Amanda. So Amanda, how can I help you today?
Yes, so I have some concern regarding my little James. He has some lesion in his right cheek and it's growing up in size. That's why I'm really worried about him.
So you mentioned that James is having some kind of lesion in his cheek, right?
Yes, true.
So in which cheek, Amanda?
Right, I said.
Right. Okay, right cheek. And can you please tell me more about this lesion?
It started since birth, and it started to increase in size. Yeah, but it's still like now is around 1 centimeters by 1 centimeters.
When you first noticed it, I mean, at his birth, how was the, like, did you measure it? Like, what was the size of it?
It's few millimeters, yeah.
Okay, now it's 1 centimeter.
Yeah.
So have you noticed any change in the color of it?
Not really, no, same color.
Same color. And have you noticed like it's, you can feel it when you touch it?
I feel it.
Yeah, I mean, is it raised from the skin?
Yes, yeah, it is raised, yeah.
From the skin, okay. Have you noticed any kind of discharge coming out of the lesion?
No.
Okay. Does he itch on that lesion?
No, but sometimes the clothes is stuck on it, but he's not itching it.
Okay. And have you noticed like any change in the border of the lesion? I mean, how does it look like in terms of shape?
It's rounded, circular.
And has it been round till now?
Yeah, same shape, yeah.
Same shape, okay. And have you noticed similar kind of lesion at any part of James' body?
No.
Okay, that's really good to And what is your main concern today, Amanda?
Because it's getting bigger, that's why I worried. So I thought it may be something serious.
So, Amanda, can you please tell me about like James, like just to know if James is doing fine. So, how was the birth of James? Was he born at term?
Yes, he was born full term and normal vaginal delivery.
Was there any hospital stay so far?
Hospital, what? Sorry?
Hospital stay for any reason?
No.
Okay, that's really good. And do you have James' Red Book?
Yes, I have. Yeah.
And are you happy with that?
Yes.
Is he up to date with the jabs?
Yes.
Okay. And Amanda, in terms of development, like, are you happy the way James is developing?
Yes, he's absolutely fine. Yeah.
Hear about it. And who takes care of James at home, Amanda, apart from you?
My husband.
Okay, your husband. So everything okay at home?
Yes.
Okay. And apart from this lesion, Amanda, does James have any other condition that you'd like to mention to me?
No.
Okay. So, Amanda, ideally, I will be examining James. Okay. So,
All
I will be checking James' observation. Then also, I will have a look at the lesion. Okay.
Okay. So they will show you the lesion. Yeah.
Okay.
Same pictures we saw earlier.
So Amanda, apart from just to take you back, just a few more questions. You mentioned that the clothes get stuck, right?
When I try to wear him, dress him with his clothes. Yeah. Because it's rough, it's not smooth. That's why the clothes is stuck. Yeah.
And for how long these clothes are getting stuck?
No, it just I take it off. It's not something stuck forever. I guess when I try to dress him up, because it's on his face, yeah, so he doesn't dress on his face. But when I try to put any shirt on, so it is stuck initially, and then I take it off and just yeah.
Okay. And do you feel that this lesion is any way affecting like James, the way James eats food?
Not really, no.
Okay. And anyway, is it affecting James' vision? Do you think that way?
No.
Okay, that's really good to hear. So, Amanda, do you have any idea what is this lesion?
I thought it's a birthmark because he was born with it. But as I told you, I was worried just because it increased in size.
Exactly. Just what you have told me that James is having this lesion on his right cheek, and it has been there since he took birth, and recently it's increasing in size, right? So, and also having a look at the looking at the lesion, I'm also suspecting it's a birthmark, and specifically like looking at it, it look. I think I'm suspecting that it might be something which you call hemangioma.
All right. So is it serious?
Well, Amanda, this is not, as you have mentioned, that it is not affecting the feeding of James, or it is not affecting the vision or any way, any kind of like breathing of James. So at this point, I can assure you that it's not serious.
All right.
So, do you know what is this hemangioma, Amanda?
No, not really.
Well, it's one kind of like a benign tumor of the blood vessels, like the pipes that carries our blood. Okay, that's why it is like bright red in color.
All right. So do you have any medication for it?
Well, Amanda, the thing is like the main, like as it is a birthmark, initially what happens regarding this birthmark, they increase in size up to like 2 or 3 years of a baby's age. But after that, it keeps on shrinking by itself. Are you with me, Amanda?
Yes, I'm with you, but are you going to treating it or not?
Well, at this moment, as I have mentioned, like we just need to keep on checking because it will shrink by its own. And within like we are hoping that within 7 to 8 years of James' age, by like it will keep on like disappearing. It will disappear, and as it is not causing any problem, any kind of physical problem to James, so at this point there is it is not indicated to remove this lesion or give any kind of medication.
All right.
So anything else, Amanda, I can help you with?
No, that's fine for now.
Yeah, so you were asking about the medication. So for this reason, like I will talk to my senior and I will double check everything. And there is one kind of medication which we can give if in order to decrease the size. Basically, it is just to decrease the blood supply to that lesion. But I have to double check it with my senior whether we can give it to James or not. Okay, Amanda?
All right, yeah.
And but at any time, if you see that it is keep on growing more and also any kind of bleeding, or if you feel that the border is irregular, and by any way if you feel that it is affecting James' feeding, breathing, or vision, then please bring him to us immediately. Okay.
All right, yeah.
Okay. Okay, thank you very much. Then in our next consultation, I will just have a look at James. All right.
All right.
Thank you, Amanda. Oh my God.
Thank you so much. Yeah, great. Okay. So, is anyone wants to add any comments before I do mine?
I will up.
All right. So everyone is silent today. All right. So it's amazing in terms of medical knowledge.
Newcomer. Yeah, she's good.
Dr. Kabir, you have some big noise. Okay. So yeah, it's very good. Yeah, and good medical knowledge, good structure, and you ask the best questions and past medical history. Did you ask me past medical history, all of it, like medications and?
No, I forgot about the medication.
Yeah, okay. Medication and allergy, yeah, you forgot this. It's really important to ask, but overall is very good. Just the IBS, like sympathy and empathy and these things, like nothing's like you didn't tell me anything.
Yeah, that was missing. I was about to tell that something missing, like sympathy.
Yes.
Yeah, your tone is very good. So just all you need, and you involving me, you care about me somehow in your tone and the way you explain things to me. But it will be just much better is if you added some few sentences to make it for the examiner. Yes, you have good communication skills. So just let's try to grab every single chance to enhance this area. Like for example, this mother brought her child. Just say thank you so much for coming to see us today. I can see that how caring mother you are. For example, any or pediatric station, you can add this, something like this. Thank you her for bringing her child. And I told you I'm really worried about him. So tell her, I can see that you are worried, but please let me reassure you. There is nothing to worry about. Or even in the management, if she told you earlier, I'm worried, so you can say later on, like you told me that you are worried, but from my full assessment, there is no anything worrying at all. So just even you show that you have good listening skills. And when you told you I'm worried, so acknowledge it back. I can see that you are worried. I will do my best to help your little James. If you don't mind, just I will ask you a few questions to be in a better position to reassure you. So the IBS part, just try to don't miss it because it's really important. It really makes you kind doctors, because they don't want anyone who has good medical knowledge, because when you work here, you will find you don't need lots of medical knowledge, because there is always senior doctors in your head. So the only thing you need to have a perfect history, organized, and it has to be good history, like whatever the patient telling you elaborated in depth. and you need to be very kind to the patient, and you need to have good English. So this is what junior doctors need. Same thing in Lab 2, they assessing this stuff. You have to be safe, and I can see that you refer to your senior, but already your senior told you before the session starts, there is certain indication for giving medication, he doesn't have one of them. So he doesn't need any medication to shrink the size, because in the cake and it's still very tiny, it's not too big to just to make it small. So it will disappear by time. There is no need for any medication at the moment. Just as you said, if it gets bigger or because initially it will start to grow, and at some point it will stop and shrink back. It up to 5 years can completely finish. So it takes time to disappear, but just you can just reassure the mother. But it's very, very well done. Yeah, you give safety netting, so it's really good. Also, like to increase the IBS, also just I asked you many questions. Says I just really very valid concern. Let me explain it to you, or this is very good questions. Okay, good.